The first is our, it's called our Quit Act legislation. And this local law establishes a tobacco retail license. This is similar to how New York State requires tobacco retailers to have a permit before selling tobacco products. What we want to do is make sure that these shops and any new licensure occurs for shops that are more than 1,000 feet away from a school. We're also announcing, as part of this initiative, is a very important, it's a partnership between the county exec's office, the Department of Health, and it's an announcement of the allocation of $150,000 in grant funding that is going through the Albany County Improvement Initiative for Tobacco and Substance Abuse Prevention. So this initiative is open to all public school districts and charter schools in Albany County, as well as individuals, not-for-profits, for-profit corporations, and other non-public entities. What it's all about is trying to encourage and incentivize outside organizations to develop anti-vaping, anti-addiction, anti-tobacco programs targeting young people in the schools. And what we hope to do is we hope to incentivize more schools in Albany County who otherwise might not have the resources to put together programs that aim to get into high schools, middle schools, even elementary schools, to start the education process to help our kids not even kind of go down the road of vaping or tobacco products.
As our children return to school, it is paramount for parents, teachers, and other adults to identify and be aware of these youth-appealing products. They're deceiving, easily concealed, and disguised as common school supplies that you would never suspect hold something that can seriously harm our children.
It's our solemn responsibility to take care of not just the mental health, but the health of children, and to educate them. And I don't have to look at the statistics and I see the sign, they start before 18. We almost have to get into, I would say, middle school and start educating them before they even think about vaping. The fact that we're having this open, frank discussion on this about tobacco use, and everyone that's here, from the Teachers Association to everyone, can't thank them enough, and for the leadership in the legislature and our health department to really take money and try to make a difference with the education piece to inform families, but to have that where they can go and get the resources at the school districts or nonprofits, where, let's face it, schools are stretched thin now when it comes to money, and anything we can do, like we did with bus patrol, to put resource officers in there, mental health people, and let them worry about spending the money on education, on learning, and not, this is education, but let us handle that. They handle the education piece, and we'll get it done.
We know the tobacco industry aggressively markets these products at our kids, and we are taking a stand to do something about it. A tobacco retail licensure will help the county reduce the sale of illegal tobacco products to minors. They're going to be able to monitor these stores. They're going to be able to penalize people who are doing this to get these products out of the hands of our kids.
These cigarettes, these electronic cigarettes, have volatile organic compounds. They have carcinogens, as well as higher levels of nicotine that can affect the young growing body. Things like increasing premature signs of aging to more dangerous things like heart disease and lung disease. So it's incredibly important that we intervene at an early age.
So when you give out school supplies, check them out. Just like you check out Halloween candy, check out the tools that kids are using when they go to school. We do have to help our young people stay clean, stay healthy, so that by the time they're my age or older, they don't have some of these health conditions that will allow them not to have the quality of life that they so deserve. You take care of your body now, you'll have a body to enjoy as you get older. I also chair the Elder Care Committee, and I do see people in our nursing homes and even living at home that are constantly having to have some piece of equipment with them because their lungs are not working the way that they're supposed to, and some of it is because of smoking.
The legislature is hosting, along with the county exec and the county controller, at 112 State Street and the first floor of the Cahill Room. We are hosting, it's an event, I guess. It's called Hidden Dangers. What this is, and we teamed up with the Addiction Care Center of Albany with Dan and Jen. What this is, it's a replica of a teenager's bedroom. And the hidden danger piece of it is to illustrate and show parents, educators, administrators, grown-ups, PTA members, school individuals, anybody who is working with kids and teens. It's to illustrate essentially all the places a young adult, a teenager, a child will hide their vaping device, their drugs, their cigarettes. So this bedroom will help highlight the fact that we as parents, as educators, as individuals who want to do something about the addiction epidemic, we're really up against a very sophisticated industry that is really good at helping kids hide what they're trying to keep from their parents or loved ones. We're also going to have experts that the Addiction Care Center has plugged us into that will conduct resources and workshops and education efforts throughout the entire day. We're going to invite, and I love that the PTA is here of New York State. We're going to invite all the school districts, all the parent-teacher organizations, all of the parent groups that we can think of, as well as going through all of the school districts around the county.